This is case of the day, and now we've reached 130th case, and just look at the beautiful image here. Uh, so this is titled The Honeycomb Pattern of Myositis, and the 61-year-old was discovered to have a myopathy just about 3 months ago, and I guess it must have been subclinical. And so we've done the whole myositis protocol, which I had detailed in case 21, and I will show a link in the top right sometime somewhere in this video. But you can see here this classic honeycomb pattern involving the hamstrings. There is involvement of the rectus femoris, but the vastus muscles are spared. And if you blow this up, you get this very characteristic honeycomb pattern where there is high signal intensity with fluid inflammation on the stir image, all encasing or around the various muscle bundles. So again, if we go back to this seminal 2024 paper from the Japanese group that looked at these 6 different patterns of involvement, the honeycomb pattern is one such, and I think the honeycomb pattern I am showing is far better than the one that they've used to document. And according to them, it correlates with inflammatory cell infiltration of the perimysium, with the reticular high signal intensity reflecting interstitial edema from perimysial inflammation. Now, as MSK, or as people who do MSK radiology, endomysium, perimysium, epimysium, these are not terms that we use because we're dealing with larger structures, not internal characteristics of muscles. But I looked at the Wikipedia entry, and this is an image there. It's very nice. So it shows you the muscle fiber, the muscle fascicle, then the endomysium, the perimysium, which is along a set. So it covers one unit of multiple fascicles and muscle bundles that we see here, and it outlines those. And the epimysium would be all along the fascia here. So it's interesting because when we see the honeycomb pattern, we're outlining the perimysium, and my feeling is that when you're seeing signal in the individual muscle fascicles, I guess there is involvement of the endomysium as well. Now, what does this mean? So I asked ChatGPT to take the article and make it a little more understandable because they have constraints of space, and so a lot of the tables are related to the scientific data. So when I asked it to, it's given these 6 subtypes and then all of this rich data. But the important thing is that the honeycomb pattern is seen typically in DM and in overlap myositis, and the other patterns show others. Now, you can also get honeycombing in the antisynthetase syndrome. I should have put a circle here as well. And so if you look at the honeycomb pattern, you'll see it in DM, also in antisynthetase and in overlap syndromes. And I think that's pretty much what you would get. But it's most common with dermatomyositis, and the patient's not really been worked up as yet. So if and when, then I'll put it up in the comments as well as perhaps a post. But if you remember, I'd done 53, which was the symmetric facial pattern, and I'd done 21. But just to put these together, so I have the images on the workstation anyway, and I just put these 3 cases together. So this was 21 where I'd only talked about the protocol, but now when you look at it, it's actually the peripheral / foggy pattern together. This is an early DM where you get the facial pattern, and that's the whole important thing, that when you have patients with DM coming really early, then you have epimysial involvement, and when you're doing biopsy, since the muscle is not involved, you can miss the facial epimysial involvement, and that's what people have to be careful about. And then we have the honeycomb pattern here, which can be DM, antisynthetase syndrome, and overlap syndrome. So hopefully when the patient is worked up, biopsied, etc., we will come to know what this is. But the pattern is very striking, and I think we should mention this in our reports. And I guess in the next within the next year, I should be able to see the rest of the coarse dot, fine dot, and perhaps just foggy and peripheral patterns and then show them up. And I guess at the end, we'll have a course that we could do on different patterns of myopathy involvement. So it is possible that in the future, specific patterns of involvement may point towards specific myopathies. They still do, but perhaps even better, and help with subclassification and prognosis. My WhatsApp channel, and thank you so much for viewing this.